When we think about medical treatment, we often picture a fight, a battle against illness, a race to find a cure. But what happens when the goal is not just to defeat a disease, but to live well with it? This is where a special kind of medical support comes in. It is called palliative care. This is a gentle approach focused on providing comfort and improving the quality of life for people facing serious illnesses. It is not about giving up. Instead, it is about adding a layer of support. It is care that addresses the whole person, not just their medical condition. It helps with pain, stress, and other symptoms, making each day better. For many older adults, life can bring chronic conditions. These are illnesses that may not go away, like heart failure, arthritis, or lung disease. Managing these conditions can be very difficult. There can be constant pain, shortness of breath, or deep fatigue. This is why palliative care is so important for the elderly. It provides relief from these symptoms. It helps older adults maintain their independence and dignity. The goal is simple but powerful: to ensure the best possible quality of life for as long as possible. This care can be given at any age and at any stage of an illness. It is a common misunderstanding to confuse palliative care with hospice care. They are related, but they are not the same thing. Hospice care is specifically for people who are nearing the end of life. Palliative care, on the other hand, can begin at the moment of diagnosis. It can be provided alongside curative treatments, like chemotherapy or surgery. Think of it as an extra team of experts working for you. This team focuses on your comfort and your well-being. This allows you and your other doctors to concentrate on treating the illness itself. It is a partnership for better health and a better life. So what does this care actually look like? It starts with a conversation. A team of specialists sits down with you and your family. They listen to your concerns, your fears, and your goals. They ask what is most important to you. Is it being able to sit in your garden? Is it having the energy to play with your grandchildren? Or is it simply being free from constant pain? Based on your answers, they create a personalized care plan. This plan is designed to help you achieve those goals. It is a roadmap to a more comfortable and meaningful life, even in the face of serious health challenges. The primary mission of palliative care is to manage symptoms. For many elderly patients, chronic pain can become a constant companion, making simple tasks feel impossible. Palliative specialists are experts in pain management. They use a wide range of tools, from carefully managed medications to non-medical therapies like massage or acupuncture. They work tirelessly to find the right combination that brings relief without causing unwanted side effects. But it is not just about physical pain. They also address other distressing symptoms like nausea, anxiety, trouble sleeping, and loss of appetite. The focus is always on making the patient feel as comfortable and as well as they possibly can. This specialized care also addresses the emotional and spiritual needs that come with a serious illness. A diagnosis can bring feelings of fear, sadness, and uncertainty. It can make you question your beliefs or your purpose. The palliative care team often includes counselors, social workers, and chaplains. These professionals are there to provide a listening ear and a source of strength. They help patients and their families navigate these difficult emotions. They offer a safe space to talk about worries and find sources of hope and peace. This holistic approach recognizes that a person's well-being is about more than just their physical body. Improving quality of life means helping people continue to do the things they love. It is about adding life to their years, not just years to their life. A real-life example might be a grandmother with severe lung disease. Her main goal might be to attend her grandson's wedding. The palliative team would work to manage her breathing so she has the stamina for the event. They might arrange for portable oxygen and coordinate with her family to make the day smooth and enjoyable. It is this practical, goal-oriented support that makes a real difference. It empowers patients to stay engaged with their lives and the people they care about most. This focus on living well also means helping patients maintain their independence for as long as possible. The team can suggest practical changes at home, like installing grab bars in the bathroom or arranging for a comfortable chair. They can connect families with community resources, like meal delivery services or transportation assistance. By addressing these everyday challenges, palliative care helps older adults stay in their own homes, surrounded by familiar comforts. It is about empowering them with the support they need to live safely and with dignity, preserving their sense of self and control over their own lives. Palliative care is never the work of just one person. It is a true team effort. At the heart of this team is a group of dedicated medical professionals. This includes doctors and nurses who have special training in managing complex symptoms and having sensitive conversations. They are joined by pharmacists who help find the right balance of medications. Physical therapists might work on mobility and strength, while nutritionists can help with appetite issues. Each member brings their unique expertise to the table, but they all share a common goal: putting the patient's comfort and wishes first. This collaborative approach ensures that every aspect of the patient's well-being is considered. The most important members of this team, however, are the patient and their family. Palliative care is built on a foundation of open and honest communication. The team takes the time to explain complex medical information in a way that is easy to understand. They listen carefully to the family's observations and concerns because no one knows the patient better. Regular family meetings are common. These meetings are a chance for everyone to get on the same page, discuss what is working, and make decisions together. The patient's voice is always the most important one in the room, ensuring that the care plan always reflects their personal values and goals. Let's consider a real-world scenario. Imagine an elderly man named Robert who is living with advanced heart failure. He feels constantly tired and short of breath. His palliative care team includes his cardiologist, a palliative nurse, and a social worker. The nurse visits him at home to adjust his medications to help his breathing. The social worker talks with Robert and his wife, helping them fill out advance directives to make sure his future medical wishes are known. The team communicates constantly with his cardiologist to ensure the palliative plan complements his heart treatment. This seamless teamwork means Robert feels better and his wife feels supported. This partnership is incredibly valuable for families who are often the primary caregivers. Caring for a sick loved one can be physically and emotionally exhausting. The palliative care team acts as a vital support system for them too. They teach family members practical skills like how to manage medications or help with mobility. They provide emotional support and a listening ear when caregivers feel overwhelmed. They can also connect families with respite care, which provides a temporary break so caregivers can rest and recharge. This support helps prevent caregiver burnout and allows families to focus on spending quality time with their loved one. The benefits of this supportive care extend deeply to the family. When a loved one is unwell, the entire family feels the strain. There is worry, stress, and often a sense of helplessness. Palliative care provides a lifeline. By improving the patient's comfort and reducing their symptoms, it eases a significant burden on the family. When a parent is no longer in constant pain, their adult children can feel a sense of relief. Knowing that a team of experts is watching over their loved one brings peace of mind. It allows family members to shift their role from full-time, stressed-out caregivers back to being spouses, children, and grandchildren. This support system helps families navigate the complex healthcare system and make difficult decisions with confidence. The team acts as advocates and guides. They ensure that families understand the treatment options and what to expect as the illness progresses. This shared decision-making process is empowering. It means that families are not left to figure things out on their own. Instead, they have a trusted partner to turn to for advice and reassurance. This can be especially helpful during moments of crisis, providing a calm and knowledgeable presence when it is needed most. The result is less confusion, less anxiety, and better coordinated care for the patient. Ultimately, palliative care is a profoundly kind and intelligent choice for older adults facing serious health issues. It is a declaration that their comfort, dignity, and quality of life are the top priorities. It shifts the focus from simply fighting a disease to living as fully as possible. It honors the individual by asking them what matters most and then building a plan to help them achieve it. This approach respects the journey of aging and acknowledges that good care is about more than just tests and treatments. It is about compassion, support, and the gentle touch of human connection. Choosing palliative care is a positive and proactive step. It is not about giving up hope. It is about redefining it. Hope can be for a cure, but it can also be for a pain-free day, for a chance to share a final story, or for a peaceful state of mind. By providing comprehensive support for the body, mind, and spirit, palliative care helps older adults and their families find strength and meaning. It is a testament to the idea that every day matters, and that compassionate care can make every one of those days better. It is quite simply the right thing to do.